Hello, dear parents. Is your baby sick? Do they have a fever? Are they coughing? Don't worry, you're not alone. Almost every parent faces this worrying situation. Our babies are everything to us, and it breaks our hearts when they're sick. In this video, I'll share some simple but effective home remedies for dealing with fever and colds in babies. Keep watching for natural and safe solutions for fever and colds in babies. Together, we can help our little ones recover faster and more comfortably. As many of us know, a fever is actually our body's way of fighting infections. But when it comes to babies, a fever can easily make us worry. You're right, because babies' immune systems are still developing, and a fever can be a sign of a more serious underlying problem. So, what's a normal body temperature for babies? It usually ranges from 97.7 to 99.5 degrees Fahrenheit. But every baby is different, and small fluctuations within this range can be normal. The important thing is to observe your baby's overall condition. If your baby's fever is 100.4 degrees Fahrenheit or higher, it's very important to see a doctor immediately. This is especially critical for babies younger than 3 months old. A high fever can be a sign of a serious infection, and timely intervention is vital. In addition to fever, if your baby has symptoms such as weakness, restlessness, loss of appetite, vomiting, or diarrhea, be sure to consult your doctor. Remember, early diagnosis and treatment are very important for your baby's quick and healthy recovery. Make sure you're using the correct method when taking your baby's temperature. Digital thermometers give the most accurate results. You can take the temperature under the armpit, orally, or rectally. Rectal measurement gives the most accurate result, but it can be uncomfortable for your baby. Although fever is a sign that the body is fighting infection, a high fever can be dangerous for your baby. Therefore, it's very important to check your baby's temperature regularly and consult your doctor if you have any concerns. Remember, your baby's health is the most important thing. When in doubt, always consult a specialist. When your baby has a fever, there are many things you can do at home to comfort them and bring down their temperature. Here are a few suggestions. First, make sure your baby is dressed in comfortable, light clothing. Overdressing can cause their body temperature to rise even further. Cotton and breathable fabrics are best. Plenty of fluids are very important during a fever. Frequently breastfeed or bottle feed babies who are breastfed or formula fed. You can give older babies fluids like water, freshly squeezed fruit juice, diluted, or electrolyte drinks. A lukewarm bath or applying a wet cloth can help lower your baby's fever. Fill the tub with lukewarm water and sit your baby in it for a few minutes. Or soak a cloth in lukewarm water, wring it out, and place it on your baby's forehead, neck, armpits, and groin. Keep the room temperature between 72 degrees Fahrenheit. The room shouldn't be too hot or too cold. Don't cover your baby too thickly. Don't give your baby any fever-reducing medication without consulting your doctor. Some medications are not suitable for babies and can cause serious side effects. Check your baby's temperature regularly and follow the suggestions above. If your baby's fever doesn't go down, or if they have other symptoms, contact your doctor immediately. Remember, every baby is different and can react differently to a fever. The important thing is to observe your baby carefully and consult a specialist if you have any concerns. The common cold is one of the most frequent illnesses in babies and is especially common in babies who go to daycare or school. Because babies' immune systems are still developing, they are more vulnerable to viruses. So, how can you tell if your baby has a cold? Here are some common symptoms to watch out for. Nasal congestion or runny nose. Your baby's nose may be stuffy or they may have clear, yellow, or green discharge from their nose. Cough. A cold usually starts with a mild cough, but it can get worse over time. Restlessness and sleep problems. Your baby may be restless and have trouble sleeping because of a stuffy nose or cough. Slight fever. Some babies may have a slight fever with a cold. Loss of appetite. Your baby may not want to eat because of a cold. If you notice any of these symptoms, it's likely your baby has a cold. Most colds are harmless and go away on their own within a few days. However, there are some things you can do at home to help your baby feel more comfortable. Here are some natural remedies you can use at home to ease your baby's fight against a cold and make them feel more comfortable. Clear nasal congestion. A stuffy nose can make it difficult for your baby to breathe and feed. To relieve nasal congestion, you can use sterile saline solutions sold in pharmacies. Put a few drops of saline solution in each of your baby's nostrils, and then use a nasal aspirator to clear out excess mucus. Use a nasal aspirator. After putting in the saline drops, Gently use a nasal aspirator to remove the loosened mucus. Humidify the room. Dry air can make nasal congestion worse. Put a humidifier in your baby's room or place a basin of hot water to add moisture to the air. Give a warm bath. A warm bath can help your baby relax and clear their nasal passages. Fill the tub with lukewarm water and let your baby sit in it for a few minutes. Breastfeed or bottle feed frequently. It's important for babies with colds to drink plenty of fluids. Breastfeed babies who are breastfed frequently. Give plenty of formula to babies who are formula fed. Keep their heads slightly elevated during sleep. Laying your baby down with their head slightly raised can make it easier for them to breathe. You can put a towel or a thin pillow under the head of their mattress. With these simple methods, you can alleviate your baby's cold symptoms and make them feel more comfortable. Fever and colds in babies are usually not a cause for concern and can be easily treated at home. However, in some cases, you may need to consult a healthcare professional. Here are the situations where you should call your doctor immediately. High fever. If your baby's fever is above 100.4 degrees Fahrenheit, or if they are younger than 3 months and have a fever, call your doctor immediately. Difficulty breathing. If your baby is breathing rapidly, making wheezing sounds while breathing or pulling in their chest to breathe, seek immediate medical attention. Excessive lethargy and refusal to feed. If your baby is sleepy and unresponsive, refuses to feed, or is much less active than usual, call your doctor. Cough or nasal congestion lasting more than 3 days. If your baby's cough or nasal congestion lasts longer than 3 days or gets worse, consult your doctor. Earache or ear discharge. If your baby is pulling on their ear or there is discharge from their ear, they may have an ear infection and need to see a doctor. Remember, when it comes to your baby's health, it's always best to be cautious. If you have any concerns, don't hesitate to consult your doctor. Fever and colds are common in babies and can often be managed at home. I hope the information I shared in this video helps you comfort your little ones and helps them recover quickly. Remember, every baby is different and can react differently to fever or a cold. The important thing is to observe your baby carefully and consult a specialist when necessary. Your baby's health is the most important thing, and when in doubt, it's always safest to consult a doctor. I wish you healthy and happy days. Don't forget to like the video and subscribe. Keep following us to learn more about your little one's health with our new videos.